Hi, everybody. Good afternoon. This is the explanation of the lesson that we will have next week from April 25 to 29th. And we will start a new lesson. Please watch this video so you will see what to do during the week. Okay, I'll share my screen and then you will see what is the homework and what to do and when we have lessons on our blog. Okay, so I share my screen. For the new students, I have a couple new students. So this is our blog. It's a good idea to check it out daily if you can, because it says everything. What's for the morning group, what for the afternoon group. It's called blog, level 2 blog for teacher Carolina. Every level has a different blog and different things to do. Okay, so let's see what we will be doing this week. So this week we will start to learn about medication, pharmacy, warning labels on medication, and how to talk to the pharmacist. It's not all this week. Actually, we start with the vocabulary and then we'll continue on next week and probably the week after. This is very important thing. So I will put the video in here. You can watch it anytime you don't understand how to do it. So let's see what we have for for the new student before I forget. If you see a yellow heart, that means it's for the morning students. If you see a little blue heart next to something, that means that's for the afternoon student. And if you see a green heart, that means it's for both morning and afternoon students. Okay, so as you see, there is a green heart next to Monday. Make it bigger, so you have a green heart. And that means that both morning and afternoon students should do that. So we have the new words introduced. Maybe you know some of them, maybe you don't. So the words are called vocabulary. Okay, so we have this one about medicine. I make it bigger so you can see it. Okay, we have cream, band-aid, ointment. Ointment is kind of like a cream, but most of the time cream is in a tube and ointment could be in a different container. Pills, shot, drops, ear drops, nose drops, eye drops, cough syrup when you're coughing, especially for kids, and aspirin. So if you want to repeat and know how to pronounce these words, you can click on the little speaker and then you can say it after ointment. Pills. You can practice as many times as you feel that, oh, now I can pronounce it. I know what it is. Okay. For the new students again, once you start this and you see the new words, please copy these new words in your notebook. So later on, when we do these exercises on the top, then you can use them and you know how to spell it. I show you why. So match up what you have here. You have the little speakers at the bottom. You have to click on the speaker and put it next to the correct word. So let's see. First one, it says drop. So I take it with my mouse or with your finger if you are doing it on a phone or an iPad or a tablet. And then you just put it where it belongs. This one says shot. I put it next to the shot. And once you finish all of them, there is in the top right corner, you have this check answers. You can click on it and you can check your answer because these exercises you are not sending back. When you finish with this exercise, in the top left corner, you have an arrow that you can click on, and then you can go to the next exercise. So the same kind of idea here too. You see, you take one aspirin and you put it under the correct picture. Okay, then you have ointment, you put it under the correct picture. Cough syrup would be this one. Pills would be this, pills and capsules together. Band-aid, shot, drops, and cream. And when you are done with it, again, you can just check your answers. Okay, it's all good. Then you go back, click on the arrow, go to exercise number 3. The same thing. Listen, it says cough syrup, I put it under the picture. It says it's a shot, I put under the picture. Again, you can check your answers. And then when you are done, you go back. And this is the fill in. So that's why it was a good idea for you to copy the words in your notebook, because now you know how to spell it. So if you are not sure, you look into your notebook and say, oh, that is C-R-E-A-M. So then it's good. And then you know how to spell Band-Aid, and then you will know how to spell tablets. And of course, you can check your answers again. And if you are not doing too well, then try again. So the dictation, it's again, it's good if you copy the words in your notebook, because now you can copy with the correct spelling here. So you click on the speaker and it says ointment. If you don't remember how to spell it, look in your notebook, ointment, and click again. That's when it says shot. Okay, and so on. You can check your answers, and then when you finish, you can go back. If you did good, you don't have to redo it. If you feel that, oh, you need more practice, then you can practice some more. Okay, so this was one of the practices for Monday. And let's see what else we have here. We have another practice like this. So this one is at the pharmacy. We have, oh, sorry. This is bottle, doctor, drugstore, prescription medicine. And on the top, you have 1, 2, 3, 4, 5 exercises, the same as the other one. I'm not explaining this again. You do the same way as you do the other one, as I explained it. Okay, then let's see what else we have. Let me make it smaller. Then we have 2 little exercises here. It seems, yes. Okay, so health and safety at the pharmacy. What you have to do, you look at the picture and say, click on the correct answer. Is it cough drops? Is it pain reliever or cold tablets? Which one do you think it is? I would say it's maybe pain reliever. This is not very clear, so don't worry about it. If you pick this one or that one, it's not drops for sure. Okay, and it doesn't look like a tablet. It looks like a caplet. Okay, number 2, look at the picture. Is that a cough syrup, a nasal spray, or eardrops? It looks like cough syrup to me. Okay, pain reliever, ointment, or eye drops. You remember ointment is like a cream, so this looks like a cream to me. Okay, vitamin C, B12, that will be vitamins. And this one, they are called tablets. Okay, then the same thing here, you keep continuing, and when you finish, these are called capsules, eardrop, and then when you finish, that's the pharmacist, you click on the finish button. Please put your name in and click on send, and the teacher will get your answers, and I can look at them, and if it's not correct, then I can correct it for you. Okay. And this is the other exercise with the same pictures. You have to listen and choose true or false. So you can click on the picture, and it says vitamins. Do you think these are vitamins? I don't think so. I think this is false. Okay, let's click on the second picture. Cough syrup. Yeah, that's true. Okay, you do a couple more. Click on the picture. Ointment. That's true. Make it just a little bit bigger. I click on this picture. It says tablets, but these are vitamins, not tablets. These are the tablets. Okay. Eardrops, that's true. You have to listen and what you hear, say if it's yes or no. You remember, if it's true, it's yes. If it's no, it's false. Okay. So again, when you finish with these ones, these are all true, false. Then you click on the finish button, type in your name and click on send. So this is the homework and practice for Monday. Okay, let's see what we have for Tuesday. Now, for Tuesday, we will have class in Carolina's room on Messenger at 9 o'clock from 9 to 10. And afternoon students, they will have their class in Carolina's room at 10:10. Okay, so we have a 10-minute break between the 2 classes. So the ones who do both morning and afternoon, they have a chance to have a small break. Okay, so if you look at this picture, this is a pharmacy and there are all kinds of boards in it. on it, pharmacist, prescription, prescription medication. So study these words, please. I will try to explain it and translate it for you on Tuesday during our lesson. And what you have to do after that, the morning students, they have to choose 7 new words from the picture and write 7 sentences with them. I gave you an example here. For example, throat lozenges. He takes throat lozenges when his throat hurts. Okay, you can say, for example, let's click on it again, air purifier. You can say, I have an air purifier at home. Okay, or there was the warning label. We have to read warning labels carefully. Okay, prescription label or prescription. The doctor gave me a prescription. Choose something that you know how to write a sentence with. Okay, 7 words from this picture. For the morning student. That was for the morning students. Okay, and this one, if you see, there is a green heart. That's for both morning and afternoon students. They're exercise 1, 2, and 3. Let me show it to you. So this is kind of a listening, reading, listening practice. You can listen here, or you can just read it. Okay, you can stop it and then pick the correct answer on the right side, or you can just read it. Jacob is surprised. In his home country, pharmacies or drugstores are small. They only sell medicine. In Canada, some pharmacies are very big. They sell medicine and many other products too. Okay, so let's do number 1, question number 1. The pharmacies in Jacob's home country are big, small, or the same as in Canada. It says in home country, pharmacies are small. So I click on small. It's good. And then I click here on the arrow for the next question. Question number 2. Pharmacies in Canada are very big. All pharmacies, some pharmacies, or most pharmacies. Okay, in Canada, some. You see here, some pharmacies are very big. So you just click on the correct answer. Okay, and then you can go to the next. You have 3, you have 4, you have 5 questions total. Okay, so this is 1. Exercise number 2. Here, it shows you the picture, and here you just have to say what this is. So you can buy many things at the pharmacy. Each thing you buy comes in a container. What is a container? This is a tube, or can be a box. Okay, for example, toothpaste comes in a tube. Okay, so this is it a bottle of shampoo? Is it a box of shampoo, or it's a roll of shampoo? This is a bottle of shampoo. Okay, it's in a plastic bottle. Okay, it's a tube, a bottle, or package. It's a bottle of pills again. Okay, and then what is this? Box, bottle, or roll of water? It's a bottle of water. Okay, and then you are all done. If you want all questions to see at once, you can have it like this, show all the questions. If you don't, then you can have only one. Okay, so this is exercise number 2 for Tuesday, and this is exercise number 3. Remember, this is a roll. Okay, you have here bottle of medicine, bottle of pills, bottle or tube of sunscreen, bottle of shampoo, box or package of tissue, like Kleenex, a tube of toothpaste, and a roll of toilet paper. So we are learning also about different container types. You have 3 questions here. Okay, for Wednesday, we have 2 more exercises here, and then we have the containers here that I will try to explain on Tuesday. Let's see exercise number 4. You just have to know if this is a box or this is a tube or what is this. Okay, jar. This is a jar. This is not the jar. This is a tube of hand cream and so on. Okay, we'll learn about these. Okay, then you have exercise number 5. It's also for Wednesday, exercise number 5. the same thing, but now you have to type it in. You have here bars, bottle, box, jar, roll, and tube. And all you have to do, just type it in the box. So this is a box of tissue. I just copy from here, box of tissue. Okay, good. So that's for Wednesday. And then I have 2 live worksheets. The live worksheets, please do it there. Don't copy in your notebook and send it to me like that. Just do it here. And when you click on the finish button and click on send, after writing your name in, I will get the answers. Okay, so let's just do some of this. What is that? A lip balm. Can, blister, bottle, jar, pack, tube, bar, stick, box, or bag. A stick. It's a stick. Okay. It's a stick of lip balm. Then box of tissue. So you just have to copy here from here, box. Okay. And so on. Try to find, trying to do them. It's a pack of pills, maybe a jar or a bottle of mouthwash, a pack, and so on. And you click on finish button again for the new student. And this time you don't have to send it to me. You can just check your answers. And then it will show you which ones were good. Usually the green ones are good. The red ones, because you didn't do it, they are still not there. Okay. So if you feel that you didn't do too good, then please try it again. Okay. And then we have some treatments here. Which one is number 1, number 2, number 3, number 4? All you have to do, look at the picture and write the number in the next to the picture. So for example, let me see which one we do. These are the glasses. What do we have? Oh, I saw this one. Orthopedic shoes. They are special shoes if you have problems with your feet. So orthopedic shoes is 18. And I saw the shoes here. So I just type in here 18. Okay, because that was the number for orthopedic shoes. Okay, let's do one more. For example, you have here this one, if I could show you, suture number 12. When you have a surgery, sometimes they cut you and then they sew you back, so they put sutures in it. Okay, so this is number 12. When you finish, you can click on the finish button, and this time you enter your name and click on send. Okay. So this is for Wednesday. On Thursday morning, students will have a class at 9 o'clock. Afternoon, students will have their class at 10:10 in Carolina's room on Messenger. And then I will explain all of these on Thursday. We'll do it together. Let me just show you quickly. So it's a listening, reading kind of thing, and the same thing as we had on for Monday or Tuesday homework. The same thing, you can see it here, you can read it, and you can listen to it. And then it just tells you. So for example, a dental floss. Dental floss, do you think that one is over-the-counter drug? Like, for example, if you want to buy some allergy medication, you can buy it over the counter. You don't need a prescription. That's the meaning of it. Health products, like vitamins, other things, toothpaste, toothbrush. So this one, because dental floss, that would be a health product. Beauty product, like shampoo, like other things, deodorants. And other products, they also sell cars, laundry detergent. If you go to Shoppers, you can see that they sell all kinds of things. Okay, when you finish with one, you go and click on the other one, jar of face cream. Face cream, would that be a beauty product? Because that's what women do. They buy a face cream to be more beautiful. Okay, and then you have 10 questions here. Okay. Which one was it? Where are we? Thursday. Yes, okay. So we have this. What is cough medicine? Is cough medicine over the counter, health product, beauty product, or other product? I think cough medicine you can buy over the counter. Toothpaste would be a health product. Okay. Birthday card. What is birthday card? That would be other product. Okay. Pens and pencil, other product. Face cream, beauty product, because you want to be beautiful. Antacids you can buy over the counter. You don't need a prescription. Vitamins you don't need prescription, and so on. So you can check your answers when you are done. If you see a smiley face next to your answer, that means that was good. If you see an X, then, or let me just show you something. Oh, okay, dental floss. Let me say that dental floss is a beauty product, which is not. And I check it, yeah, it still shows an X. Okay, so if it's not good, it will show an X. If it's good, it will show a smiley face. Okay, we'll do this together on Thursday. And for the afternoon students, I have a little bit different one because it's more like listening practice. So you listen, and then whatever you heard, you pick from here. Some medicines are not strong. You can play it and stop it. You remember, so you can choose the correct answer. You listen and you say, oh, I think they said drugs. So then you just click on the correct answer. It's a listening practice. Same thing here. You listen and then you pick the correct word that you heard. Okay. Then for Friday, I will send this one out. It's more vocabulary for you. And I will ask you to try to translate with Google Translate, or ask somebody in your family who speaks better English for the translation, so you will understand. But we will go through these during the class probably, and the ones you don't understand, I will try to explain it to you. Okay, then we have this video also. It's just about different kinds of medicine. You remember that most of the time these open with the ad. Don't worry, just wait until it says skip ad. Let me show you. In the bottom right corner, usually shows skip ad. Then you just click on it and then you can watch the video. Okay. Or if you like the ad, you can watch it too. Okay. So what is she doing? She put some cream or ointment on it. It's all about medicine. Okay. There are some symptoms they will tell you. It's about an 8-minute video. Viral infection. What is? Cough. He's having a cough. Okay. So just watch the video and try. Do you have asthma? When you cannot breathe, then you can use this puffer. Do you have asthma? You can use steroid. It tells you what you can use for different symptoms. Okay. Blocked nose or stuffy nose, or you feel congested. Okay, so watch this one, and then I have separated for the morning students. I have this reading that all you have to do, copy this and write it in. One day Eric felt really bad. He had a bad headache and fever. He went to a walk-in clinic to see what do you think he saw? A doctor. Okay, the doctor gave him a prescription. Then Eric went to get the something. I'm not telling you. So use these words, the black words from here in the sentences, and then pick 5 of these and write 5 sentences. You can say that I often go to the pharmacy. You can say my daughter talked to the pharmacist. I had to discontinue the medication because it made me sick. Okay, So 5 sentences plus this one you will send back to me next Friday. And for the afternoon students, please watch this video and answer the questions. There are, I believe, 4 scenes in it, but you just watch the scene 1 and scene 2 to answer these 5 questions. Okay, let me open up. So open it up for you so I can show you. You don't have to watch the whole video. You have scene 1. You see, this is scene 1, a drugstore, and then they will talk and you just listen and answer those 2 questions. And then you go to scene 2. Let me see, where is it? Oh, I think this is still, scene 1. Let me see. Okay. So see, now scene number 2. So there is another one for scene number 2. Teacher put there 3 questions. So then you watch the scene number 2 and answer the 3 questions. Don't worry about scene number 3 and 4 because that one we will do next, the week after. Okay. So scene 3 and 4, that will be practice for the next week after. Okay. Let me make this smaller and close it. So this is the lesson from April 25 to 29th. Okay, and there you go. It's April 25 to 29, and that's what we will learn, practice, and do that week. Please watch the video because it's very important to get, if you don't understand something, you can always go back and watch it and see what the teacher explained there. And I will be also explaining the stuff again on Tuesday and Thursday in Messenger when you are here. So everybody have a nice day and I wish you the best and for your English to get better slowly. Bye everyone.